Director at Mental Health Minnesota. And I was asked today to just share a bit about some things that we are doing as an organization, both to support people in the community, always, but especially during this time, as well as some ways that we are trying to take care of our staff at this time too, to make sure that everyone is well and healthy.
Getting these up, here we go.
Great, thank you. So, first, just a bit about who we are for those who may not know. Mental Health Minnesota was founded in 1939, so we actually celebrated our 80th anniversary last year. And we were the state's first mental health advocacy and education organization. We're a nonprofit, nonpartisan, and we are an affiliate of Mental Health America, which is celebrating around its 110th anniversary. We have a number of different programs that we do in the community, and I'll be touching particularly on some of these later. But the Minnesota Warm Line, the online mental health screenings, and the helpline are three primary ways that we generally work to help people in the community seeking resources and help for recovery, as well as our ambassador network. That is a network of more than 300 people across the state who themselves have a lived mental health condition and use that experience to share with others and help tell the story of hope and recovery. And so they do that through community events, and we're finding some creative ways to help them engage now. They're all recording their stories, doing video recordings that we'll be posting on social media during Mental Health Month in May. We do a lot of education and outreach, so we do a lot of different programs and presentations and speeches, as well as public policy work. So what I really wanted to focus on today is just a few programs that we have that, that can be good resources for those who might be looking for things to offer clients and patients, as well as possibly to use for yourselves. So first, a little bit about the Minnesota Warm Line. And you see on the chart, or on the graphic across the top, is kind of the way we think about the Warm Line. You have friends and family, you have crisis services, and the Warm Line has kind of a spot in between that. So it's not intended to help people who are in crisis, it's largely intended to help prevent those crises from happening. So the Warm Line is a peer-to-peer service, which means that all of those who are answering the calls themselves have a lived mental health condition. And it's really about mental health wellness and recovery. It's staffed by certified peer specialists, and those peer specialists receive training from the state of Minnesota. It's a 76-hour training that helps them learn how to share their story and use their experience to help others move into and maintain recovery. We also do some additional organizational training within Relias to make sure that our operators and our staff are really ready to take the calls that they will be taking. And that's in areas such as suicide risk assessment, cultural diversity, self-care, boundaries, motivational interviewing, some of those areas to really make sure our staff are ready. The Warm Line service is available in the evening, Monday through Saturday, and that's just 5 p.m. to 10 p.m. at this point. And can be reached via either phone or text, and all that information is on our website, actual phone number and text number. The calls are all confidential and callers are free to remain anonymous. And I think that's an important point that is the case with the majority of our services, is people don't have to tell us very much to use them. And for a lot of people that feels very safe in a world where they're used to having to share a lot of information before they can get help, or for those who perhaps have not sought help before and are kind of iffy about sharing a lot of information when they're just trying to find out what might be available for them. We limit our calls to around 20 minutes and one call per night. And the reason we do that is we see the Warm Line as really as one tool for recovery, but it shouldn't be the only thing that folks are using. And so wrapped into our calls, our peer specialists will talk with someone about what else they're going to do during that night to stay well and be okay. As I noted before, we really see it as a way to help people before they reach a point of crisis. But we do warm handoffs to county crisis teams as needed. That's only 1 or 2 a week, probably on average, but it is important that we're able to do that and really maintain our spot in that continuum. It does reduce the need for crisis intervention, hospitalization, and other more intensive and high-cost services. In fact, I just took another look at our data today, and we're up to 1 in 4 people say that they would use crisis services or call 911 or go to the emergency room if they couldn't reach us.
Say, Shannah?
Yeah.
There's one question from chat, and that is the warm line geared towards clinicians or the entire community?
The warm line is, in particular, is geared toward the entire community. In terms of a service that's geared more toward clinicians, that would be the COVID cares work that we've been involved with. And I think Linda from the Psychiatric Society is going to be talking a bit more about that later.
Yeah. Yes.
Great. And I'll let her do that. Perfect. Thank you. So the next piece is the Connect initiative. And this is something new that we just started in the last couple of weeks. It's really intended to provide some social connections by phone between our volunteers and people who may be struggling a lot with the social isolation, loneliness, stress, anxiety, worry, all the things that a lot of people are feeling at a really elevated rate at this time. We see Connect kind of as an extension of the Minnesota Warm Line because it's really based on a kind of we're all facing this in our own way kind of approach with our volunteers just reaching out to people. Members of the community can sign up to receive calls from our volunteers, and they can sign up either using a short form on our website, or they can call our helpline. And we really just ask them for a first name, a phone number, and what county they're calling from, just so we have a little bit of information. And so we're able to actually reach out to them. Those who sign up are receiving calls from our volunteers 3 to 5 times a week. And we started making calls last week, and volunteers have already made more than 50 calls, with a lot more scheduled this week. But we have a lot of volunteers who are really excited to connect with people, have had a lot of great feedback from those who are getting calls, as well as from volunteers, that they've really appreciated the opportunity to just talk to somebody else. So then we also run a helpline. And again, I used kind of that continuum of friends and family. What should I do? Where should I go? And EAPs or insurance companies, and certainly providers and others would be farther down the line. And the helpline is sort of in the middle again. Our helpline provides some pretty basic information, resources, referrals related to mental health. It also helps provide some basic information and expectations or understanding for services. And as an example, I would say someone would call our helpline and inquire about psychiatry. And so our helpline staff would talk, ask first question, do you have insurance? And then talk about that a little bit, and how they should reach out to their insurance company to find someone in network and talk through that, understand what their benefit set is. But they would also try to kind of set expectations that, the wait times that we know exist for a lot of folks in psychiatry. And so they might say, know that you may wait a while for a psychiatry appointment. You might be able to get in to see a therapist, though, much sooner. And in the meantime, feel free to call our warm line tonight. It opens at 5. And so it's really about helping people understand what's out there and sort of what their expectations when they start to make those calls. We expect we'll take around 1,000 calls in 2020. That's open Monday through Friday during the day. And it's available via phone, but also via email and online chat. And we actually have about 2/3 of the inquiries for the helpline come in via online chat through our website rather than phone calls. And the service, again, is free of charge, anonymous, and confidential. And, for a lot of people who may not be ready to call their insurance company or call an EAP, or may not feel comfortable tying their questions to their name and their record, this is kind of a safe space for them to just call and ask some questions. So another piece that we offer has been mental health online screenings. And so again, I did that kind of the continuum because this is how we talk about it a lot in the community. For those who may feel like a screening seems like a scary thing, it's like, okay, there's stress and worry, and there's anxiety, and there's a lot of stuff in between, feeling down and alone, and depression, and a lot of stuff in between. And it's identifying, we use screenings as a way for people to identify when they might be moving over into a place where they could use some additional help. So again, that's free, confidential, anonymous, that are available on our website. And those also include youth screens that are focused on 11 to 17-year-olds, as well as parent screenings for parents of young children who may be concerned about what's happening with their child, and so they can take a screening kind of based on their observations. The screenings use commonly recognized instruments. So it's the PHQ-9, it's the GAD-7, those sorts of instruments that many of us are familiar with. There's been an increase in anxiety screenings of nearly 20% in recent weeks. Not surprising, given all that's going on in the world, but certainly something we should be paying attention to. And if a screen is positive, the person is then taken to a landing page with local resources. So they will put in a zip code from where they're screening, and then if they screen positive for something, they'll be taken straight to a page that has some information about what to do next. And we expect there'll be probably around 8,000 screenings in 2020. I believe that nationwide, we just passed the 2 million mark recently.
So Shannah, I'm just going to pause for a second. I just want to highlight, I asked Shannah to kind of talk about all this really great work that is in the community. One, so that you all have an understanding, because this is something that can be offered patients, staff, family or friends of staff, right? We're talking about supporting our workforce, but our workforce might not always want to go internal, right? We're offering a lot of internal things, and that's great, and some might prefer internal help, and others really might not. And so the option of going external to the community where they can feel anonymous might really work for some. So I think they go hand in hand, and I thought it was really important to understand these services and to be thought of as community, but our workforce is part of the community as well. They're patients as well. So, okay, sorry, Shannah, I just wanted to give that little plug. I'm going to turn it back to you.
Oh, no worries. I think that's a great point. And it does reflect some feedback that we do get from callers who, when we start asking them about health insurance and EAPs, they'll be like, whoa, not ready to do that. Just have some questions. And so it is a kind of an open feeling, because people don't have to tell us really much of anything at all. We usually ask for county just so we can help them narrow down the resources that might apply to them. So then I was asked to just talk a little bit about how we're supporting our staff at Mental Health Minnesota. So first, who are our staff? Because we're a smaller community organization, we have 4 full-time staff, but we have 15 part-time staff members. Most of them are certified peer specialists who work as part of the Warm Line, somewhere between 10 and 15 hours a week. A number of them are on Social Security disability, and so this is a part-time role for them. And the majority of our staff do themselves live with a mental health condition. And so as we build out services, as we make shifts to work remotely, all of those things, we've had to really make sure that we're being real thoughtful about how we're supporting our staff who are more accustomed to seeing each other on a day-to-day basis and providing that support to each other. So some of the things that we've been doing and some ways we've adapted, during Warm Line hours, our Warm Line staff are all on Google Chat to support each other. We really built the Warm Line intentionally to be all in one place so they could provide support to each other. And so it was really important for us to find a way to still offer that, despite the fact that they are all, at this point, working remotely from their homes. We also have a peer specialist who works as a supervisor during each shift. And so the supervisor on duty will check in individually with each Warmline staff member or operator as well during every shift, just to make sure things are going okay, answer any questions, and just kind of check in and connect with that person. We've moved our Warmline staff meetings to every 2 weeks rather than once a month. And those meetings are places where they can kind of process difficult calls, but they can also just talk about what it means to be a peer specialist, because it's can be a complicated and sort of unique role in this field. We are going to be adding volunteer mental health professionals weekly to assist with processing calls. And so that's another layer of help that we are providing to our operators as well. We also provided access to an app that's called Sibley that provides mental health coaching. Because in absence of having an EAP as a very small organization, we wanted to try to do more to support our staff. And then finally, we have added, starting next week, a weekly support group for employed certified peer specialists. Now, that won't simply be internal, that will be external as well, encouraging certified peer specialists to connect with others who are also employed as peer specialists, because as I noted, it is a unique piece in the mental health field, because a large part of your job is sharing your own experience to help others do better. And that can be really rewarding, but it can be really draining too. And so we feel like it's important not just to support our own staff, but all of those working out in the community.
Shannah, I have a question.
Yeah.
You mentioned adding a volunteer mental health professional to help in processing calls. Do you mean actually taking calls or helping staff debrief, kind of process what they go through in taking their calls?
Helping our own staff debrief. And so this is something that we had been doing a couple of years ago, and our operators really appreciated having the opportunity to just process calls. And I kind of liken it to, group supervision that I got when I was getting my master's degree, that there'd be a licensed psychologist every, once a week. All of us who were sitting down and working as interns would all get together and talk through particularly difficult calls and how to handle them, and questions about boundaries and all of those things. And I think that becomes even more important when we're talking about peer-to-peer work, because it can be very easy to go a little too far in sharing your own story, and then you feel very vulnerable. And so it's important for us to support that.
Thank you.
Other questions from Shannah? So Shannah, while I give people an opportunity to chat in or even share their own experiences, particularly if they're from a community organization, what's your kind of feedback loop? So is it through these kind of these twice a month meetings that you're hearing what they need, or how are you going to assess kind of what you have in place and make sure it's, the things they need?
Sure. Well, in addition to the meetings that I mentioned, our program manager stays in close touch with with our nightly supervisors. So she connects in with them every night. And given that everyone's remote, she's also been checking in general with the whole group each night. And so she's able to gather that feedback. And then she and I work together to determine what are some things that we can do. Again, as a small organization without a lot of capacity or funding available to meet those needs, what are some creative ways that we can make sure that we're taking care of our staff?
Fantastic. Thank you.
There's a couple questions in chat. One is, what is the number one call that you're getting during the COVID response?
Well, in general, our Warmline responds to a lot of calls from people who are feeling very isolated. It's not uncommon for our callers to our Warmline to say that they haven't talked to anybody else all day. That's become even more common, unsurprisingly, as a lot of the services that some of these folks do depend on to stay well, like drop-in centers or clubhouses or day treatments or other things, have either shifted or may not be available at all. And so they're feeling even more isolated. So I would say that that's coming up quite a bit And I think we also have seen the level of intensity of our calls, because we ask our staff to indicate what they feel from 1 to 10, the level of intensity of any given call is. It has started to creep up a bit over the last few weeks as well.
Thank you. Another is, how often does substance use disorder come up as a co-occurring condition in the calls?
Quite frequently, not surprisingly. And so we do encourage people to make those calls as well. It's really intended to be aligned to provide support in the community. It's not like someone has to report their diagnosis when they call us. We are just looking to support whomever needs help. But certainly from some anecdotal information that we get from our callers, when sometimes we ask them, how has the warm line helped you? We have a number of callers who have reported that they have been able to reduce or eliminate alcohol use or other substance use because they have someone to connect with at night.
And another is, we'll stay on the same theme here. This question is, are you seeing increases in calls related to domestic violence? And if so, any advice on how to handle when folks may be required to shelter in place?
We have not seen a significant increase in that. As I said, many of the people who call us live alone and are pretty isolated. So we're not seeing a big uptick in that, although, certainly I think we're all acknowledging that is happening, that there is more heightened need to address that in our current situation when we're all in shelter in place. Generally speaking, if our warm line staff do get calls like that, they will certainly, respond and talk through with someone, but they also will provide some other resources for someone to call as well.
Thank you, Shannah. And then, final one so far, have you received calls from any frontline staff or clinicians from large healthcare systems?
Well, it's hard to say because we don't ask questions about that. And so we're not necessarily tracking data around that because really people call to talk about what they're feeling, not really what that's based on. And so I don't know that we have, but I don't know that we haven't. But I think that we've also been encouraging those who would call in that circumstance to consider some of our other work, such as the partnership around COVID cares.
Thank you.
Thank you, Shannah. Really appreciate this. And I also just want to highlight that when Shannah and I talked last week, I really was struck by this kind of idea of teamwork. Healthcare professionals, whether it's typical medical care or behavioral health professionals, are used to practicing in teams. A lot of it is you can be there, support each other, answer questions, right? The warm line was designed to be done as a team. And I think clinics are team focused, right? You have backup. And now that people are practicing in isolation, right, some form of care, that's really hard, not to have a team member to run something by in real time, to know, am I doing the right thing? Because it's not what we would usually do. Because usually I could bring you in and check a lab or take a history in a different way or look at you and get an assessment. So, we're asking them to provide a different kind of care alone. And so the mechanisms you set up, I thought were really great and wanted to, give the group that provide that problem and then what your solutions were, just to think about that. Now medicine's a little bit less of a team, and how do you recreate the team in a different way? So I appreciate what you're doing. I think your resources for the community and then what you're doing for your staff hopefully can give some ideas to those on the call. So thank you. And I'm going to ask Linda, who I know is on the call, to maybe talk a little bit more about COVID cares. And I'm going to stop sharing.
Sure. Well, thank you very much. And as Shannah's already said, this is really a partnership between Mental Health Minnesota, the Minnesota Psychological Association, Minnesota Black Psychologists, and the Minnesota Psychiatric Society. And we're happy to lift up the fast tracker information so that we can have a sort of a central clearinghouse of information where people are already sort of used to going for mental health information. So that's how we got it started. And basically what it is pretty much a warm line for frontline personnel. So all healthcare workers, first responders, essential personnel. And I really want to mention how much of a collaboration this has been. And honestly, I feel like, speaking of the teamwork, I'm on the dream team with this collaboration. It's really been encouraging and uplifting. And I know if, it's kind of hard to keep, plugging along, doing your job and figuring you're doing the best you can, but it's so invigorating really to be part of this process and this offering, so that we're working hard, we're addressing problems as they come up, we're sort of making this up as we go. And we've been really encouraged by the number of volunteers. We just started April 13th. So, I mean, it's only been, this is week 3. And we've got 80 volunteers. We're covering from 9 a.m. until 9 p.m. And the idea is they're basically 20-minute support calls. So when we're asking licensed personnel to be the volunteers, not because we want them to provide licensed services, but because we want them to be fully prepared, because we wanted to be able to lift this up like instantly. And we know that those licensed personnel have the skills that are needed to help people sort of navigate these really unwieldy times. And so it's been really amazing how quickly this all came together. Necessity, is one of those things that really in some ways can be very helpful. And Trish has been just doing a wonderful job of helping the volunteers, work through the process. And Shannah's been amazing at getting the word out and helping us, elevate some of the information that she just shared with you, and her expertise around how phone lines work and how warm lines work and how to get, QR codes out to people. So we have flyers on the website that can be printed and hung in like break rooms, where personnel can take a picture of the QR code, which I didn't even know until this morning, but Shannah can track how many of those pictures are taken, which doesn't that blow your mind? But anyway, so she knows that even though we haven't had a great deal of traffic in terms of callers that have been logged on our call sheets that Trisha's managing, we do know that people are gathering the information, and we also know that the need is building. And we're feeling really confident about the kind of resources that we have available, and that we're ready for when the surge in need comes to us. So basically the process is people go to fasttrackermn.org. Right on the front page, there's the official COVID-19 information resources. The very first thing it says is COVID Care Support Services. It describes the service as special 20-minute support calls. And you just click on there and it brings you straight to the information site that has information about, it's got the flyer, it's got what COVID Cares is, it's got the volunteer portal, so if you want to volunteer. On April 17th, Governor Walz did mention the project and pointed everybody toward the resource. And so we have a little video clip of him, and also have some other sort of resources on the page. And when you click in there's a box right at the top that just says COVID Care Services Daily Availability Listing. You click on there, and on laptops, it'll show you basically a calendar view of all of the names and phone numbers of people to click on to make a call during that time. And we've advised people to use their cell phones, because when you use a cell phone, we've reformatted it so that it rolls by that day, and you just click on the phone number. And again, one of Shannah's magical technology tidbits, we were able to help our volunteers access Google phone numbers that allow them to be accessed specifically at that point of time, and not have to share their personal cell phone numbers to be volunteers. So so far so good. We haven't had a lot of trouble. The hardest part really is keeping up with the volunteer traffic. So that's it. So Tricia and Shannah, do you have anything else you'd like to add?
Well, I think I would just reinforce that the service is completely anonymous and confidential. And I think that's important because a lot of those who may call for help perhaps haven't sought mental health support in the past. And so I think we want to make it very clear that this is just about finding support during a really difficult time.
A couple of clarifying questions on the COVID Cares in chat. One is, what training do the volunteers have or receive?
Well, that's one of the reasons we asked for licensed personnel to volunteer. So basically, we just, they have the information about what the service is, and we describe in detail what it is not. We do ask volunteers not to make referrals to themselves, that we are basically helping people navigate if they need a deeper level of care, but primarily just giving them the support they need and a listening ear. And that's basically the service. This is not therapy, it's not treatment. So we're not offering a specific training program. That's another thing, is we felt like this is a very time-sensitive lift, and we wanted to make sure that we could get it up and running in a short period of time. We do, though, have, with the information, and Tricia could probably speak to this more, when the volunteers sign up, she connects with them and gives them all the information that they need, and also identifies who might be, if they have a very difficult call or they need to debrief, there are people who have volunteered to provide that service as well. So Tricia, do you want to mention anything about the FAQs and any of the responses that you've gotten there?
People have just been very appreciative of the information, and they're very appreciative that there's someone to back them up and there's a place to process if they need that.
One of the other questions is, say a little bit more about how many calls you've received so far to the COVID Cares numbers.
Yeah, so far we haven't gotten a bunch of calls on the logs, but we're not certain that we're hearing whenever people get a call either. It's still, we're still getting our feet under us, and the volunteers are still navigating, how to respond and record and everything. So we only have a handful of calls. But we do have, as Shannah was able to identify, I can tell you that we've seen an increase of traffic on the Fast Tracker site by about 400%. And I did take a look at the traffic on the COVID Cares scheduling page and information page, and that went up about 200%. So, and then it drops off over the weekend. I don't know what to tell you about that, except maybe people are actually looking for those phone numbers. And it really did drop off over the weekend too. But I'm seeing a lot of traffic. I'm not certain if people are, planning for when they need to make the call, if they're putting it in their phones, like with the QR code, if it's ready to go when they need it. The other thing is that we're hearing things, people have, as we're all sheltering in place and we're around our kids and we're around our colleagues, I think sometimes people are waiting until there's a time in their car or there's a time when no one else is around. So I really feel like the fact that we have this service available till 9 o'clock at night is really going to be an important aspect of the service. But we're really in gearing up mode right now. We haven't seen too much traffic, but I am feeling confident that when we do, when the traffic picks up, we will be ready for it.
Jody, you're on mute.
Thank you. Thank you for the updates. You know, I encourage all of you on the line to really help us get this resource out. We at ICSI often say 7 times, 7 ways. So telling people once is not enough. They need constant reminders, particularly busy providers, of something out there. And I think in light of what just happened in New York with Dr. Breen, I think it is now weighing heavy on everybody's minds and is a, you know, an opportunity to really bring mental health and support to the forefront and show, you know, your staff that there is support out there. So just encourage you all to help spread the word for us.
Thank you, Jody. I would just reemphasize that. And what I can do is send a clickable link to Fast Tracker to Tani to share. And then also I see that she did share the link to the COVID Care Support Services. But I'd like to also send the flyer that Shannah prepared with the QR code.
That'd be great.
And ask for your help to get the word out.
Perfect. And we'll keep reminding, again, we all need to hear things. There's so many resources, so we'll keep reminding this group as well.
Thank you so much.
Thank you. So I'm going to segue a little bit and really in spirit of what we've been talking about. Tani is going to pull up, you know, a lot of emails come our way, your way, I'm sure, and all the things that we can be doing. And one of the emails that struck me was kind of a compilation of this advice from frontline hospital leaders, whether it's CEOs, CMOs, COs, whoever it is, saying, I'm in the thick of it. Here's what you who are about to be in the thick of it at some point need to know. And they broke it up into different topics. I kind of picked out some of the ones that struck me related to the work we're doing. And so I'm going to share a few of them, and then I'm going to kind of just want to get your thoughts. And so this is the CEO from Boston Children's Hospital, Sandra Fenwick. I'll give you a second to read it, and feel free to read and ignore me, but I'll talk while you read too. And essentially saying communicate, daily updates, weekly virtual town halls. We talked a little bit at the first meeting here of town halls, but I think it highlights the importance to do them often and, you know, scheduled as opposed to just now and again. And the thing that struck me of what she said that was different, and I didn't see a ton in the thread, was say thank you and say it often. So for leadership to express thank you and gratitude to the workers is an important component of this. I think we can keep going, Tani. So this was from the Louis Shapiro, the present CEO of Hospital for Special Surgery. He talked about visibility and communication as well. And he touched on something which made me feel good because you all have brought this up, as remember your hidden heroes. So that was a good term for it. We called it support services, but hidden heroes was another way to say it. Your environmental services, engineering. We haven't really talked about engineering, the supply chain. We talked about lab microbiology. Making sure that those people don't get missed as we kind of think about the frontline ICU or whoever is, you know, client facing. So this is from UCSF, and I like this terminology. It doesn't really say anything different, but it sticks with me of what can I remember. And this was the idea of established, frequent, robust, bi-directional communication tools, right? And so I think we've all seen the organizations are doing a fabulous job of pushing out information. Here's your daily email. Here's your, you know, video. My schools are doing a great job. Here's your video. Here's this. What am I asking back, right? Is it only that I'm pushing and not pulling back? And how can you pull back in real time and hear information, give people a chance to raise questions, express their concerns? So bi-directional sticks with me. I think it's a helpful way to think about it, so nobody gets stuck in that unilateral communication. And I think we only have about 1 or 2 more. This is somebody from Florida, Health First, and I just highlighted the thing that's different to me. And this was, you cannot communicate too much, but they require leaders to do listening rounds every shift of every day using a standard small set of questions, the answers that they have to document. And so that to me spoke to the standardization, right? It's easy to collect information and say, oh, our supervisors are kind of listening, but where do you document it? And are they all asking the same questions? For the same reason why we have standardized screenings for depression, you know, I thought it was interesting to think about what do we need to make sure we're asking, and then also listen for some open discussion, but a small set of standard questions was a good way to make sure that at the very least, everybody's getting the same basic level of information from workers. So I thought that was a more good practical tip. And then the documentation, not to miss out on that and make sure things don't get missed when there's 80 things going on. And then the last one from Stanford Children's COO, the most important thing we bring isn't good judgment and effective decision-making, it's creating calm. And so as leaders, how do we create calm and making sure the communications have a tone that engenders that calm and that gratitude is essential. You know, he was saying our number one job is to keep the team safe, making them feel safe is our number two job, and that almost is a lot harder because, you know, despite everything you try to do in this era of COVID, it's hard to make people feel safe. So things to keep in mind. So with that, I'm going to ask Tanya to do our poll. So how many of you are reaching out to staff to learn about their needs during COVID and check as many as applies what you're doing? Organization-wide survey, surveying the EAP program participants, using your department chairs or your supervisors or whoever is your kind of leadership of a team, informal reach outs or not able to do it yet, or something other. Just want to get a sense of what you all are currently doing.
Thanks all who are voting. We're almost up to 50%. Okay. Anyone else? Oh, good. There was another. Okay. I'm going to go ahead and end the poll and share.
Fantastic. This is really helpful. So a lot of those informal reach outs, which I think is where you get a lot of the really good information that people maybe otherwise aren't willing to share. Use of kind of leaders, department chairs, 48%, organizational wide survey, 22%, EAP is expected. So I'm curious for, in any way you fill this out, if you're willing to kind of speak up on the call, what have you done that's been helpful? What maybe hasn't been helpful, where you're using something and saying, you know what, this is not getting us what we need and we're going to explore something different. This is where just getting kind of your thoughts on what's happening now would be useful to the group. And you can feel free to just speak up or to write something in the chat.
So at March, we've used a series of different tools for getting input. One, we instituted an all-member wide meeting once a week, which we've just concluded since we've come through the thick of the brunt of things. And in that process, we also created smaller learning communities where individuals that share the same title and function can come together in a smaller group where it encourages broader dialogue and more open discussion. And those are peer-led, making sure that they know that it is peers coming together and not somebody monitoring. And then the last tool is all-member surveys, which we're on 3.0, and we'll continue going and gathering information. Thank you.
Thank you, John, for sharing. That's helpful. So you have a multi-pronged attack there, which is probably what's needed. Anybody else?
Jody, this is Jeff Leichter from Sanford. So, you know, I think I had presented a few weeks ago on some of our employee well-being strategies. And one of the things that I did last week was, in association with our Human Resources Department, was to reach out to our EAP provider for our health system to find out what the engagement has been. And I was surprised to find that engagement had actually gone down in March compared to January and February. And so we talked a lot about why that might be, and there were a lot of theories about it. But one of the things that we have done in the last few days is to invite our EAP provider to meet with our human resources department and our internal marketing department, as well as some of our behavioral health leaders, to make sure that we all knew what EAP did for us. And I've worked for Sanford for 30 years, and I'll be the first to say I didn't even realize what EAP did. But even more so, to make sure that strategic leaders within our organization knew about it. And so we're working right now on a plan to use our own marketing department to really lift up what the benefits of EAP are. It's just sort of been there in the background, but a lot of people just don't seem to really fully appreciate what they do and the depth of what they do. So as far as the what doesn't work, just having it there didn't seem to be doing a lot. I'm hoping that using our own marketing department to really push this message out will increase the utilization.
Fantastic, Jeff. Thanks for sharing. And I'm sure others have a similar experience, whether they have the data or not. You know, I'm sure that's not unique to Sanford. Other thoughts, comments, questions for the group?
Jody, if I could, I just was going to respond to a question on about the COVID CARES line I saw in the chat. Is that
Sure.
okay? Okay. There was a question about what happens if the line is busy when someone calls. And I just wanted to note that actually we have most of our slots now have 2 mental health professionals available in them, and that's building all the time. We have more and more volunteers signing up all the time. So if the first person you call, the line is busy, try the second. Because generally, at least at this point, that shouldn't be a concern. And we have a lot of people interested in volunteering. And so if we feel like there's a significant need, you know, we'll look at adding a 3rd slot and do another call out for volunteers. So I'm optimistic that that won't happen, or that there won't be other options for someone to call if they do reach a busy signal.
Fantastic, thank you. And I see in the chat we have a comment from Megan that at Redwood, they've used an organization-wide survey, and now they're starting round 2 of one-to-one informal reach outs. They've also used increased training in kind of some of the Duke University resiliency training and air care. So Megan, if I'm gonna reach out to you, I think you have a lot of good things in there that I would hope that we can present to the group in future weeks, what you've learned, what's been helpful. Sounds like you're trying a bunch of different approaches. So thank you for sharing that. So we want to keep teasing this out. Feel free to email us. We want to chat with you if you're doing something so we know what we can share with the group. You know, I think that similar as that we had this framework for the different roles and how you need to kind of target interventions, I think similarly communication and bidirectional communication needs a multi-pronged approach, and different workers will respond to different things, right? And so teasing some of that out, I think, will be helpful to how we can learn to adapt and change and do those little kind of PDSA cycles. So fantastic. Tanya, can you go to maybe the agenda again and just next steps? So next week, we're going to have Essentia present their grief services support and hopefully add another speaker as well. And then I'll also share that ICSI is presenting this work, your work essentially. What we've tried to do is, you know, put it together. At the ENRI, they're having kind of weekly conferences on different things. Tanya, do you want to share a little bit about ENRI? You've been a little bit more involved than
Sure.
I have.
Yeah. So ENRI stands for the Network for Regional Health Initiatives. These are about 50 organizations across the nation, similar to ICSI, having this community improvement for health mission, although many of them are very different than ICSI also. So we will be sharing about this work with those organizations who also have different healthcare system members. And by that, not only share, but also hope to find out from some of those other healthcare systems across the country, what are they doing? And looking at then in a couple of weeks, 3 weeks, I believe, bringing this conversation, broadening it, and adding in some national examples along with this conversation.
So we're excited about that. We're excited to share what you all have done and really bring it to the community, and likewise share back what they others who have done it, who are at different stages in the COVID experience, right? Then their stories and what they've experienced can hopefully help us as well. So that is the goal, is to kind of expand our audience. I think after the 5th, we will also move to these meetings being twice a month instead of every week, just to give some more time for development, right? And for you to be able to figure out what's working, what you're doing. So we'll send that out, that information, and the calls will be moved to Wednesday. Currently, there is a Minnesota COVID Echo that's utilized, and I will send you that link because you all are welcome to participate. It's open to everybody. That is sharing a little bit more clinical information and public health information about COVID. It's not really focused on what we're talking about, but there are, we think, people on that call that would benefit, you know, leadership, administrators who would, I think, really be advantageous to have them hear what you all are talking about, and how that helps spread the work you're doing among their departments and things like that. So we're hoping to expand the audience by moving the call to Wednesday. Tani, am I missing anything?
No, I think that's good. I would say, you know, to this group here, and we'll be further discussing this with our mental health steering committee and others, is that we don't want to lose any opportunities that we have as a Minnesota and regional community to pull some threads together here, both to support our workforce or to better support mental health in general in the state. So we'll be continuing to do that work, even as we broaden up part of this conversation nationally, and would really welcome, you know, any questions, concerns, or thoughts that you have about that in future as well.
So thank you all, Shannah, Linda, Tricia, special thanks to all the work you all are doing. We will sure to spread the word. We'll provide the links after this call. And again, feel free to reach out to us during the week to let us know if things, that ideas that we can present. And we're trying to write all these programs down in little vignettes to just share. So if you could send us something, that would be much appreciated, whether you're a large healthcare system, community org, you know, public health, doesn't matter. We want to really be able to provide examples for all that breadth of settings. So have a good week, everybody. We will see you next week. And thanks for staying on the call. Take care.